Hello, my name is Marianne Counterman, and today I would like to talk to you about two disorders that affect 2 to 5% of our children: attention deficit disorder and hyperactivity disorder, more commonly known as ADD/ADHD. I am going to share with you what ADD/ADHD is, how this disorder affects our children, treatment option side effects, important facts to know before treatment starts, and other treatment options to help our children. As I stated before, ADD/ADHD are two of the most common childhood disorders affecting around 2 to 5% of our children. This disorder affects the child's ability to pay attention to tasks and can cause them to act out at inappropriate times. Some of the symptoms to look for in children with ADD: the child will often struggle to pay close attention to details and many times will make careless mistakes. They often have trouble paying attention to tasks they are doing, and they do not appear to be listening when spoken directly to. The child does not often follow through with directions, fails to finish their activities, chores, and school projects. Other symptoms to look for in children with ADD: they often have difficulty keeping or getting organized for tasks and projects. They often experience anxiety, and they dislike tasks that require substantial mental effort. They often misplace things needed to complete their tasks. They're easily distracted by outside sources that cause them to take focus off their tasks, and they often forget steps or items needed in activities on a daily basis. Symptoms to look for in children with ADHD: they often squirm in their seat, they fidget or tap their hands and feet. They often feel the need to leave their seat even when it is not acceptable to do so, such in a classroom setting. They often run around and climb on things during class time or tasks that require focus, and they are often unable to play quietly with other children in a structured setting. Other symptoms to look for with children with ADHD: they often appear restless and appear to be on the go. They talk non-stop. They blurt out answers before being called upon or even before the question is completely asked. They often have difficulty waiting in lines or waiting their turn, and they often interrupt others. While many of us think that our children show these symptoms much of the time, children with these disorders will show them all the time, usually for 6 months or more, and the most important factor to consider is how much these symptoms impact the child's social or academic life. Most of these children are diagnosed before age 12, and the symptoms must appear in more than one setting, such as at school and at home and at church. The treatment options for these children: the most common treatment option is a type of a stimulant medication. The medication is methylphenidate, and the most common brand is Ritalin. These medications have been proven to be successful in helping children to better focus on their tasks by allowing them to tune out distractions. Stimulant medications appear to be relatively safe. These medications do come in several forms. There's pill form, capsule form, as well as liquid or patch. The dosage can come in a short-acting, long-acting, or extended-release form. Although the medications may appear to be different, most of the ingredients are the same. They are just released in the body differently. These options allow for modifications to be made should the child experience side effects. In some cases, there may need to be several modifications made to the dosage until the best option is found for the child. Some of the side effects might be sleep problems, a decrease in appetite, and in some rare cases, a slightly higher risk of strokes, heart attacks, and even sudden death. It is suggested that the child be closely monitored when starting these medications and throughout the use of the medication, and if any of the side effects are detected, to contact the prescribing doctor right away. There is a possible long-term side effect as well. It is suggested that children who take stimulants over an extensive length of time should be checked by a doctor on a regular basis for possible cardiovascular complications. The effect on the heart were noticed even years after the treatment had been stopped. Some of the less common side effects are repetitive movements or sounds called tics. In some cases, psychiatric issues could arise. The child could begin hearing voices, have hallucinations, or appear to be manic. When any side effect is detected, call the doctor right away. The doctor can lower the dosage or change the distribution of the medication. The doctor may also want to prescribe an antidepressant or blood pressure medication to help cut back on certain side effects. Another treatment option for these children may be behavioral therapy. The behavioral therapist will teach the child how to change their behavior. They will also teach the child how to monitor their own behavior to learn to better control themselves. Behavioral therapist not only works with the child, but works with the family as well. They will help the family learn to move forward from bad feelings that may have harbored from past events. They will also help the family to become better organized and explain to them why it is important to be organized. They may also encourage the family to help break down large tasks into several smaller tasks to help more manageable tasks for the child. In many cases, 2 or more treatment options may be suggested to the family. Both medication and therapy may be used in the treatment plan in hopes that the child will learn to better cope with changes. This concludes my presentation. I hope this helps any family who has concerns for the well-being of the child and their family. God bless.